In the chair. I just pre-numbed Sherry, which I don't often do, but I did use the topical that I use for permanent makeup around the eye. It is pH balanced, so if it were to get into the eye, there's no chance of it burning or irritating the cornea. So, of course, she's got Syringoma. We've got her before and after photos up. She's got a few here, and then most of her issue is down through here. So we're going to get started, and I have our setting at 25, and I have our F12. Now I'm going to give you a little touch first, Sherry, just to make sure everything is good for you here. And I like to start with one of these outside Syringomas, which is a sweat gland issue. There's no, even though it looks like there could be like these could be milia, they're actually dry inside. So I'll be using a little bit of witch hazel, and I'm just going to let you see what this will feel like. On a scale of 1 to 10, 10 being the worst, how was that for you?
3.
Okay, good. Even with a little bit of numbing agent, they still feel it. So I don't like for anybody to think it's going to be actually nothing. You can see how this tissue changes, and that's done. So what I'll do is just come right across and do the rest. Fairly quick procedure. However, you must let your client know that they're going to have a little crust everywhere you work. I'm doing a tapping motion similar to what I would do with flat hyperpigmentation because this is dry. I need to moisten it. You doing okay, Sherry?
Fine.
Oh, great. So what did your doctor have to say about these Syringomas?
When I asked her, she told me she would have to dig each one out individually.
Oh, okay.
So she was not happy to do it.
And it doesn't sound real good either. Sherry probably will need a second treatment. Hopefully I'll be able to get every single one. Even still, she's got a few large ones that may need a second treatment. And she will be a little puffy, and when I say little, I kind of mean a lot. If you have clients that have Syringoma and you're a little unsure, do this outside portion, let them go home, let them come back in 30 days, get their feedback on how it was for them before you actually do all of them. I know the crust will be everywhere we work, and she's up for that. I also suggest sleeping on the back to avoid sleeping on the side or tummy, obviously tummy, but even on the side, if she slept on this side will be puffier tomorrow, but that does subside. This part of the face does tend to heal pretty quickly, so, but because of the Syringoma being pretty extensive, it may also just stay puffy a little bit longer. So they just have to be prepared. Turn it this way just a little bit. Good. Okay. Got some lower here too. It is a delicate area. You can tell that she probably puffs in the morning anyway, so this may be a little bit puffier in the morning too. I'm just looking to make sure. I think I got them all. Okay. On this eyelid, she does have a few little skin tags too, so we may as well, get those. Another Syringoma.